Slippery elm, known as Ulmus rubra, is a tree native to North America that has been used by the Native American tribes for centuries for its medicinal properties. It can be taken in many different forms and has been used from everything from sore throats and coughs to digestive issues and ulcers to a topical solution for skin irritation. Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and I'm the owner of the Movement Paradigm Integrative Health Center in the Philadelphia area. And I'm also a medical educator for Ruba Health, and I'm excited to dive into slippery elm today. Before we get into the 8 different benefits of slippery elm, let's get into the unique properties of why this tree is so valuable. So the inner bark of slippery elm contains mucilage, and when this is mixed with water, it creates a gel-like substance. This, in essence, is called a demulcent, which creates this protective film or coating that you can appreciate how is going to be very beneficial in treating some of the symptoms that we'll get into, such as respiratory issues, GI issues, and skin issues. Additionally, slippery elm can contain soluble and insoluble fiber, which can make it a very powerful prebiotic and producer of short-chain fatty acids, which are vital for optimal health. It also contains vitamins such as B and C, minerals such as calcium, manganese, magnesium, phosphorus, potassium, and antioxidants like beta-carotene. Let's dive into the 8 different benefits. So number 1, and perhaps the most notable, is its effect on the GI system. Because of its impact on soothing mucous membranes, we can have a wide variety of benefits, from influencing things like H. pylori, gastritis, and GERD in the upper GI system. But we can also have an impact on IBD and IBS, even influencing things like leaky gut. Additionally, it can also be considered a bulk laxative, so it can help promote healthy bowel movements and can be used for constipation. Number 2 is skin health. So just as it can be used internally, it can also be used externally as a salve to be used for things like dermatitis, wounds, and even things like psoriasis. So it can act as a protective barrier to allow the tissues to heal and recover. We also want to think about our gut-skin axis. So if we have increased dysbiosis or increased intestinal permeability, then these things are going to contribute to increased inflammation and affect our skin integrity. So we can also use the slippery elm as it relates to the oral ingestion, as we just spoke about, which can also influence positively our skin health. Number 3 is weight management. Because slippery elm has a higher fiber content, this is going to increase satiety after eating, so an increased sense of fullness. But in addition to that, it can also have a positive influence on blood sugar. So this, of course, could be very important as it relates to weight management. Number 4 is immune health. In addition to its antioxidant properties, the intestinal microbiota is able to break down the mucilage into beneficial metabolites called short-chain fatty acids. These are essential for immune health and anti-inflammatory responses. But in addition to that, that also really helps with gut barrier integrity, which is essential for maintaining a healthy gut microbiome. Because when we have increased intestinal permeability, this is going to increase our systemic inflammation. So it can have widespread immune responses. Number 5 is respiratory health. This is one of the most common things that it's used for, soothing a sore throat or even a cough, but it can also be helpful with decreasing mucus production and decreasing airway muscle spasms. This is thought to be done via the vagus nerve because we do have branches from the vagus nerve into the throat, in specifically the pharyngeal branch. Number 6 are the anti-inflammatory properties. So we touched on this earlier in terms of what slippery elm is comprised of, but we know that there's antioxidants, there's also polyphenols that are all going to be very helpful in reducing oxidative stress. So this can be part of a well-rounded anti-inflammatory protocol. Number 7 is blood sugar regulation. So as I mentioned earlier, this is high fiber. So because of that, is going to decrease a rise in blood sugar. And so therefore, it can be very beneficial in regulating blood sugar throughout the day. Number 8 is decreasing stress. So not only do we have the anti-inflammatory, antioxidant properties that are going to help with decreasing overall oxidative stress, but this can help protect us against the day-to-day stressors that may cause stress and anxiety. Although I've just explored with you numerous benefits of this medicinal plant, it is important to note that there are limited scientific studies available that are peer-reviewed or randomized control studies for slippery elm. However, anyone that has used slippery elm in their practice or as a patient know the power of slippery elm. Overall, slippery elm is generally recognized as safe. However, there are some things you want to consider. One is that it can affect the absorption of your medications. So I would recommend taking it at least 2 hours away from your medications to avoid that. As with most other herbal supplements, it is advised to not take while you're pregnant or breastfeeding. Due to its swelling properties, it is advised to not use if you've had an esophageal or bowel obstruction, or speak with your healthcare provider. Also, because it is fiber, it is important to drink a lot of water to prevent constipation or any further obstruction. So there are lots of different forms of slippery elm. So one of the preferred methods is to use a powdered form and put it in water, drink it 2 to 3 times a day, like a tea. But you can also, because of the taste, if it's not so good, you can put it in some oatmeal and mix it in there. You can also take a capsule form, you can take a lozenge, so there's lots of options. It's important that we're working with our patients to ensure that this is, in fact, the best supplementation for them. And as a patient, making sure that you're working with your healthcare professional to make sure that it is appropriate for you. One of the ways that I personally use slippery elm in my practice is specifically as it relates to GI disorders. So I use the comprehensive GI Map Stool Test, which can identify everything from infections, pathogens, leaky gut, dysbiosis, intestinal health, and so much more. And so it allows me to identify when a slippery elm may be appropriate and when it may not be appropriate. So depending on a patient's clinical presentation, in addition to their testing, I can really identify when this is going to be the best choice. If you're watching this video and you found it to be helpful and you want to try slippery elm, please reach out to a qualified healthcare provider who can guide you safely and effectively. If you're a practitioner watching and you're interested in utilizing slippery elm in your practice, consider trying the GI Map test to really identify if slippery elm can be effective in your treatment plan. And if you found this video to be helpful, please make sure to like and subscribe to our YouTube channel for more videos like this on root cause medicine.
Hey, thanks for watching our video. If you order lab tests for your medical practice, head over to rootbelt.com to order hundreds of different labs from over 35 different lab companies, including Dutch, Dr. Zeta, Mosaic, and more.